Pfizer is readying its vaccine for children ages 12 to 15, hoping to get FDA approval. The Virginia Department of Health says the plans to get children vaccinated once the time comes is to rely on schools and pediatricians to get the job done. Vaccine team member Henry Graff has more on the state's plan and their message to parents who may be skeptical.
The state vaccine coordinator says it is possible to get vaccine shots into the arms of 12 to 15-year-olds with the Pfizer vaccine as early as next week. As we inch closer to children being able to get a COVID-19 vaccine, Dr. Daniel Vula says the state began planning a few weeks ago by having local health departments reach out to school divisions and pediatrician offices. When ready, those aged 12 to 15 will be able to get a vaccine through pharmacies and health clinics, with the other two options becoming more viable this summer.
I think there are very practical benefits that will compel a lot of people to choose to be vaccinated.
Avula says school districts are experienced in doing on-site vaccinations already for the flu vaccine and other required shots each year.
I think it's very likely that many school systems around the state do host on-site vaccination efforts that either the school runs or they partner with a local health department, a pediatrician's office, or a pharmacy to come on site and administer vaccines.
But they are also aware of the vaccine hesitancy out there, especially when dealing with children, and the challenges ahead of the state.
This is less about protecting yourself and more about protecting your community, not transmitting it to somebody who is more vulnerable.
Avula says if your child is on a sports team or maybe in a crowded classroom come this fall, you may really want to consider getting that vaccine, because if a child unvaccinated is exposed, they will have to quarantine for 14 days. On your side in Richmond, Henry Graff, NBC 12 News.
Henry,